So is physical therapy a joke? Is the work that you're doing, the reason that you're investigating and looking, at videos on this channel and others, just a complete and utter waste of your time? We're going to talk about that. What's up, y'all? This is Carolina Doc PT, 13-year veteran of the physical therapy industry. And so today's video, as you could tell from the intro there, we're going to be talking about an experience that happened in our clinic just uh, several weeks ago, where a patient and their spouse were complaining to one of our PTAs that they thought that physical therapy was just a joke. They thought that this was all a waste, that it was um, not being serving the client very well, and they just basically went off on our PTA. And so I wanted to talk about that a little bit and just well, talk about that, and we'll go over some just the basis of what physical therapy is. So a lot of the principles of our bodies and how they function are simply ones of stressors and adaptations that are that your body is going through. So um, that's that's why a person can exercise. You can apply a stressor of, say, lifting weights, and so you're breaking the muscle down that's lifting those weights, and then when those muscles grow back, they adapt to become stronger so that they don't break down quite as quickly. Um, if you eat too much, you take in more calories than what you're burning, and then your body is going to adapt to the stress that is being placed upon it. And the additional calories that are coming in, your body will adapt, and then you will gain weight. That body will store those excess calories as fat so that you can use that energy later. So everything that your body goes through on a day-to-day basis is uh, basically a series of stressors and adaptations. So that's why exercise works. That's why um, uh, you know c- uh, caloric deficits and eating nutritious works. That's really basically entire uh, the entire reason for preventive medicine and preventive activities. Well, physical therapy falls into that same category. It's utilizing those exact same principles. There are no different principles within physical therapy. Physical therapy is not magic. It's not voodoo. There's no hokum going on. It's hard work that you do. The difference between physical therapy and, say, fitness and exercise is that physical therapy is being done at a lower level of intensity and more of a therapeutic range. And so that's what we as physical therapists are trying to do is we're working with those joints, we're working with those dysfunctions that the patient has within this low level of intensity, and trying to create an adaptation within your body so that then you can make progress. So to say that physical therapy is not beneficial, to say that it's a joke, to say that it's a waste of time, that's just completely incorrect. I think there's something like 1.7 million physical therapists in the world. In the United States alone, I saw recently there's 300 million uh, patient visits being done per year in the United States. I mean, it's there's are you saying when you say physical therapy is a joke, when you're saying that this is a waste, just all those millions of people just don't know what they're doing? Um, no. What's happening and what more than likely is happening in this situation was a couple of things. One, could that physical therapist that was working with them have made some changes to the patient plan of care to more accurately target those patient dysfunctions so that they weren't dysfunctions, yeah, that's potentially a possibility, and so we have to put that one out there. Um, is the patient maybe not doing their home exercises like they should? That is one thing that physical therapy does require. Is it's not enough just to do exercises just on the day that that we're actually seeing you. If you're not working hard enough at home, then I mean, a lot of that's on you. So that's is certainly a piece of the puzzle. Also, there's one other variable that people don't think about sometimes, but in physical therapy we see it quite a bit. Where if a patient's medical history is not stable, so if they're currently having some pretty significant issues going on medically, that can potentially completely wipe out whatever benefits you may be getting out of physical therapy. So, physical therapy does function on the premise of a, a stable medical situation. Occasionally, in outpatient, we will see um, patients that have an unstable medical situation as well, and then we will that will usually cause us to halt services. But the assumption is that you've got a stable base that you're working from, and especially in outpatient, most patients do. In home health, many do. In skilled nursing, many. In acute care, physical therapy arenas, that's probably a little bit more dicey. I mean, that's why they're in the hospital, right? So uh, that is certainly is a factor in the situation, and really is probably the one that was most relevant in this patient situation. Is I think they were getting very frustrated and uh, more on the medical side, and that they weren't uh, getting as stable as they needed to be so that they could then see progress with their physical therapy, and that just it wasn't happening well. So um, anyway, that I wanted to address that and put that in a video for patients so that you can understand that there are multiple variables going on within physical therapy, and it's easy to get frustrated by them. But if you will do your home exercises, if you will talk to your physical therapist and make sure that they are progressing you in the direction that you want to go, then physical therapy you can do a and some amazing things. You can make great progress. Um, that's assuming that medical has taken care of their side of the equation and have created a stable platform for us to be able to work off of. All right, this is kind of a shorter video, but I just wanted to put that out there, and um, hopefully that teaches some of you about a little bit of how physical therapy works and kind of a. So if you have any questions about that, there's certainly a lot more that could be said about that. So comment in the chat below, and then I'll maybe make another video answering those questions. All right, thanks a lot. Y'all have a good day. Later.